Okay, we might make a start. Welcome everybody to this session on dealing with childhood adversity and trauma in educational settings. Welcome to those alumni early career teachers. I know you've had a long day and I'm sure that this will top your day, not disregarding the rest of what you've done. I also want to welcome other members of the public as well as our audience who's being live streamed as we speak. So welcome. My name is Professor Andrea Ropert and I am the Director of Psychological Programs here in the Faculty of Education. I'd like to begin tonight's session with acknowledgement of country. So I'd like to acknowledge the traditional owners and custodians of the lands upon which we meet, the Cullen people, and pay my respect to their elders past, present and emerging, and extend that respect to any Indigenous people that might be here tonight. I think it's particularly fitting to provide an acknowledgement of country when we appreciate the intergenerational trauma and profound suffering that many Indigenous people have experienced and continue to experience. So tonight we're going to be talking about trauma, childhood adversity in classrooms. Now, it's nothing new to have a variety of different learning needs and experiences in our classrooms, but how can teachers best identify and support those young people, particularly on top of everything else that they have to do? So what ways do we have of embedding those sort of support systems? Just as importantly, how can educators support each other and themselves? So I'm sure many of those issues will be addressed tonight and I'm really looking forward to it. I'd like to now introduce the panel chair, Dr. Emily Berger. Hello. So Dr. Emily Berger is an educational and developmental psychologist in the Faculty of Education. She has had many roles since she's been at Monash over the last 10 years, most notably as a research fellow with the Hazelwood study in the Latrobe Valley, where she's been tracking children and adults' the impact of the Hazelwood fires on their wellbeing and children's academic outcomes. Emily is also a PhD student of mine, and her thesis continues to be a template for other PhD students to emulate. So you're in very capable hands. I'll pass you over to Emily.
Okay, I hope this is working. So I apologise, I'm going to stand here and I'm going to see how I go standing here. This room is really awkward with all the different screens and which screen I'm meant to be looking at, I'm not sure. But we'll see how we go. So thank you, Andrea, for the introduction. I'm really excited about this. When I was approached to do something, straight away I said, oh yes, please, can I speak with teachers and educators about trauma? So that's what I want to talk about today. The way the session is going to run is I'm going to give a brief 10 to 15 minutes of background information, and I've been told to move over a little bit. Is that okay? Great. And so about 10 to 15 minutes of information. And then I'm going to invite the panel up. So we have a panel of experts in this area. So I'm going to invite them up to answer some questions. And then for the last 10 minutes, I'm going to throw to audience questions. So what I'll ask you to do is, as I'm talking and as I'm asking questions of the panel and prompting discussion from the panel, what I'll ask you to do is take note of your questions. And then, as I said, for the last 15 to 10 minutes of this session, I'll invite you to ask your questions. So if you could be nice and prepared, that would be great. So I like to start and open with this quote. So it's Dr. Robert Bloch. He's the former president of the American Academy for Pediatrics. And so it's a very famous quote: adverse childhood experiences are the single greatest unaddressed public health threat facing our nation today. Obviously, this is referring to the United States, but what I hope from our discussion today is it's going to become very clear that this is also a very important unaddressed issue in Australia. And so we're going to talk about how schools can actually address this issue or work towards addressing this issue, knowing that the responsibility lies on a lot of different people. In terms of what are traumatic experiences and adverse life experiences in childhood, or ACEs as they're referred to. ACEs are generally physical, emotional or sexual abuse, emotional or physical neglect of a child, and household dysfunction. Household dysfunction can include a range of different things and challenges in the household, which, as you can see from these challenges, can also increase the stress in a family when we're talking about parents with a mental illness, family members who are incarcerated, family violence, parent substance abuse. So this can also lead on to further areas of challenge for families and families living in quite disadvantaged and challenging situations. ACEs are important because in high doses, ACEs or adverse childhood experiences impact on the brain development, the immune system, the hormonal systems. They increase risks of heart disease, lung cancer, and they lower the life expectancy. So studies with adults have shown that people who have high doses of ACEs in childhood can have up to a 20-year reduction in their life expectancy. So it's not only the physical, but it's also the mental health outcomes that we look at. In terms of the prevalence, so just again adding to our knowledge bank of why this is an important area, and obviously I want to acknowledge you've come along today acknowledging that this is an important area. We know that 2/3 of children in the US will experience at least one traumatic event, so one ACE in childhood. 20% of these children will experience 3 or more ACEs or 3 or more traumatic events. 12% will experience 4 or more in their childhood. 65% of Australian women who are experiencing domestic violence will have a child in their care at the time of the violence. A fifth of children in Australia have been estimated to have 3 or more stresses in their childhood. And so you can see that links up with the 20% rate that we have in the US. And 1 in 6 females and 1 in 9 males will experience physical or sexual abuse before 15 years of age in Australia. So clearly it's a highly prevalent issue, and it has impacts on later mental health and physical health as well, which I'll discuss now. In terms of those impacts on mental health and physical health, it was really the ACEs study and Filiti's study that really paved the way for research in this area. And so Filiti and colleagues at the CDC in the United States did a study, and there's been numerous other studies on adverse childhood experiences or ACEs. And what they found is that people who are exposed to 4 or more categories of adverse childhood experiences, so 4 or more ACEs in childhood, are 4 times more likely to experience depression in adulthood. And they're 12 times more likely to commit suicide in adulthood. What they also found, which is important particularly when I talk about my next slide, what they also found is that people who experience ACEs, so an adverse childhood experience in childhood, in adulthood they're more likely to engage in health risk behaviours. So health risk behaviours that they looked at was smoking, they looked at poor rated health, multiple sexual partners and sexual intercourse, sexually transmitted diseases, and physical inactivity and severe obesity as well. And probably one of the most important parts of this study, and what's been replicated in other studies as well in this area, is that they have shown a graded relationship or a dose-response relationship between the number of ACEs you've experienced in childhood and the likelihood that you'll experience mental health and physical health outcomes into adulthood. So they call this a dose response or a graded relationship. The more ACEs you have, the more likely you are to experience mental health problems in adulthood. The more ACEs you have, the more likely you are to experience physical health problems, heart disease, cancer, chronic lung disease, liver disease in adulthood. This is from the CDC, and it's a visual representation of exactly what I've been talking about, and it taps into some of the things that you would see as well as educators and other professionals in schools. Again, looking at the bottom here, and we have how adverse childhood experiences. What we know for the developing brains and bodies of children who experience ACEs, adverse childhood experiences, lead to problems with the developing brains and bodies of the children. So it can impair their developing brain, development of the prefrontal cortex for planning, problem solving, controlling impulses in the classroom. It can also lead to other problems in childhood, such as things that might look like attention deficit hyperactivity disorder or ADHD, autism spectrum disorder or ASD. It can also look like anxiety disorders or co-occur with anxiety disorders or conduct disorders in children. And so again, it's this disrupted brain development that leads to disrupted neural development in children. Disruption of the brain cortex and regions of the brain responsible for emotion regulation, planning, problem solving, controlling impulses. As I've said, very similar to the children that we would see in the classroom who might have ADHD or autism spectrum disorder, it leads to these social, emotional and cognitive impairments in the classroom. And again, that's because of the underlying neural development and problems with the brain development of these children. Also because of the increased stress hormones as well that these children experience after repeated exposure to stresses as well. So their body and brains are flooded with stress hormones, making it harder for them to concentrate, to engage appropriately with peers, to regulate their emotions in the classroom or in other places. Because of these impulse control issues and other issues in terms of planning and problem solving, it leads to the adoption of health risk behaviours. And so the health risk behaviours are similar to what I discussed before in terms of smoking, unhealthy diet, for example, obesity. And then, of course, we know that adoption of health risk behaviours, of course, we know that leads to disability and diseases, and then early death. So in severe cases, that early death that I was referring to. Taking it back to the classroom setting, if I can, this is another really great model to understand what is happening for these children in the classroom. So I want you to imagine that this example here, this triangle here, refers to developmental trauma. So developmental trauma is trauma typically that happens within the home, and it's typically repeated trauma. So ACE is exactly what we're referring to. And so you have a child in the classroom who is cued just purely for survival. They don't feel safe in their home environment. They don't feel safe in their school environment. And that can be for various reasons. So you might have worked with a child in the classroom who can't have the door closed to the classroom. You might have worked with a child before who gets extremely upset when a teacher yells or raises their voice, or in overcrowded classrooms with lots of noise. And this is because of that triggering fight or flight stress response of the children. They are triggered to just survive, and so they're just getting through, just surviving. And so survival takes up so much of their cognitive load that, of course, then they don't have the capacity, and they're dealing with so many stress hormones to then regulate their themselves and then engage appropriately socially and emotionally. And then, of course, you have their cognition and their learning, which comes last for them. And so what I'm going to talk to you about now, before I invite the panel up just quickly, is I'm going to talk to you about what schools can do and talk about trauma-informed practice, what schools can do to actually reverse this triangle somewhat for these children and turn it more into this triangle. So when we are able to create spaces where these children feel safe and secure and with predictable routines and structure, we can work somewhat in schools to flip this triangle so that their survival is achieved quite easily, and therefore they can regulate, engage socially and emotionally, and then their learning can follow through. So, trauma-informed practice, this is how we're going to work to flip the triangle. So, trauma-informed practice is exactly what you're doing right now. It involves coming along to training seminars, talking with your colleagues, sharing resources with your colleagues to improve the realisation and recognition among educators, but also health professionals as well, and many others, about the impacts of trauma in childhood and in adolescence as well. Trauma-informed practice talks about improving the response of educators and also others as well, health professionals, to be able to work with children and adolescents who experience trauma. And again, that's through training, but also structural change in schools. The reason why we do this in terms of improving the recognition and realisation and responses of educators and other school professionals is because we want to limit re-traumatisation of children and adolescents. So we want to increase the safety and security. We're going to flip that triangle, and we want to increase the sense of safety and security that these children have in the learning environment and reduce triggers. And remember, triggers can be something that's real or perceived. So it might take a little bit of work as educators to actually decide and figure out that something is actually a trigger, because it won't make sense straight away. And so re-traumatisation is this constant flooding of the flight or fight stress response and release of stress hormones that these children are experiencing. And again, they can be triggered, their flight or fight stress response can be triggered for a range of different reasons. The final point about why we do trauma-informed practice is to limit secondary trauma among educators. This is something that I'm very interested in, and this is something that my team of researchers are working towards and working around. And it's something that I've actually added to this list of principles or pillars of trauma-informed care. And really it's about increasing support and professional learning for educators, other school staff as well. So secondary trauma, vicarious trauma, refers to the traumatic experience and the trauma-related symptoms that educators themselves feel as a result of working with children who have experienced trauma. They basically pick up some of the trauma-related symptoms. So this is almost where I finish, and this is not something that I could probably talk a lot about. I'm hoping that a lot of this will come out from the panel discussion. So as I said, I'm about to finish up, and then I'll invite the panel to come up for our panel discussion. I also recently wrote an article for TeachSpace, which is available through the Faculty of Education website here at Monash University, which introduces this table but also discusses it in more detail, and I'll provide the link at the end of one of my slides. What this really is, and some of you might recognise some of the trauma-informed models, and so the trauma-informed models are the just the top row there. What I really wanted to emphasise though is the consistency across models. And so there's several different models of trauma-informed practice that you can draw on, but what I wanted to draw on was the fact that, so these crosses represent whether these programs are doing it. I should have made them ticks probably, but it represents what they're actually doing in schools. So you can see family belonging, connectedness to families, and I'm sure a lot of you as educators work really hard to engage with families, knowing that the children have experienced trauma and the parents are likely to have also experienced trauma, or the carers might also have experienced trauma. School belonging and engagement, emotional identification and recognition, predictable routines, which I know teachers are great at, rhythm and consistency, and developing the strengths, identity and choice of children. What my research here at Monash University and with my team here at Monash University, what we're really working towards is exploring this model and these models and these principles of trauma-informed care, what's working, what needs to be adjusted, what needs to be added. So a lot of my research involves talking to schools who are either, and teachers and school staff as well, who are either using one of these models, and so they found it's useful and it has strengths, but also to speak to schools about what's not working about the models. And what we've found is that different schools with different communities and different student cohorts will actually need different levels and different aspects within their trauma-informed approach. And so a lot of my work is how do we actually embed these ideas within a schooling system. I probably do want to acknowledge as well through my research that actually when I talk to educators about this, that you guys actually do a lot of this already. And you might not actually call it trauma-informed practice, but you actually do several of these things. You just might not call it trauma-informed practice. So I'm going to thank you now. So that's my part of the presentation over. I'm going to obviously invite the panel up. I do want to let you know that if our research is continuing in this area, if you're interested in hearing more about this area, or certainly if you're interested in having your school involved in some of our programs or talking to us about your experiences, as I said, the strengths and the challenges of these programs, you've got my email address up there, and also the link to the Teach Space article as well. But that's all from me, so thank you. So now I'm going to invite Lizzie, Greg and Michael to please come up to the panel. And so what we're going to do is, rather than me introducing them to you, what I'm going to do is actually get them to introduce themselves to you, but in particular what their role is or past roles and what their experiences are in relation to working with children who have experienced trauma in schools. So we'll start off.
I'll start off. Thanks very much. So my name is Michael Devine. I am the Senior Education Improvement Leader and also Director of the Frankston North Education Plan at the moment. So Frankston North has 2 primary schools, Mahogany Rise Primary School, Aldercourt Primary School and a secondary college, Monterey Secondary College. It's in a really disadvantaged community in Frankston North, highly vulnerable. I'll just go back. Prior to that, I was at Western Port Secondary College in Hastings as principal and assistant principal, and before that, I actually started my career at Patterson River Secondary College, which is in Carrum, with Greg McMahon at the time. So there's some pretty clear themes in the schools I've worked in. We've worked a lot with disadvantaged communities and disadvantaged young people, and a lot of it does play out, particularly in trauma, and particularly some of the challenges that have faced me in my career have been around that. So I'll hand on.
Cool. Hi everyone, my name is Lizzie Moroney. So up there it says Education Director at YMCA, so that's a fairly new role for me. But prior to that, I just came from teaching for 6 years at a school in Dandenong North. The same sort of disadvantaged area and lots of vulnerable sort of people. And I guess my sort of step into trauma-informed practice was really from necessity in my own classroom, responding to what was happening around and what kids were bringing forward and families were bringing forward. So I kind of just started to research a little bit and found that it really helped my kids' learning, not only those kids who were experiencing trauma, but the rest of my class. So it's been a real passion of mine and something that I hold really dear to my heart in education. So that's kind of where I'm coming from. And then with YMCA, I'm heading out to different schools in lower socio areas and running social and emotional skills programs. So kind of building those skills up, skill sets and things like that. So that's me.
Good afternoon, my name is Greg McMahon. I'm feeling very old here. I've got an ex-student here as well, so I employed this guy as well. I started teaching in '83. I was a Monash graduate. Did my dip out, as I called it in those days here. Camberwell Grammar for 6 months. Weren't quick enough to get out of the place. Mildura for 4 years, loved it. Down to Karwatha Noble Park. During the time of the Southeast Asian influx, significant trauma. Then down to Mordialloc, middle class beach. Then down to Patterson River, where I was assistant principal and acting principal for a term there. Then picked up the principalship of Parkdale Secondary, again a big school, now 1,700, green leafy. Then when I was asked to go across to Doveton, and I think you've had Deb here today and Chrissy Tambakakis, most disadvantaged school in southern Melbourne, one of the lowest in Australia in terms of its SFO, significant trauma, and I mean significant. Never seen a place like it when I walked into it. From there, I've spent 4.5 years there, or just on, and I've been asked to go across, and I'm now running Hallam Senior, which is 2k up the road, only year 10, 11, 12, and the reason I've gone there is because our kids from Doveton needed a really good outcome in their senior years. And so I've just been at Doveton today interviewing the 30 kids who are going to then move on to Hallam next year. The issues don't go away just because you're 2k away, though. So, yeah, so that's the kind of, I suppose, the route that I've got. I can retire at the end of the year, so not sure I will, though.
That probably leads on nicely to my next question. So my next question for the panel, and any of you could decide to answer or all of you can answer, is what trauma looks like from your experience in the classroom?
I can start. Coming from definitely the least experience, but I've seen it in so many different ways, and it's really not obvious in a lot of senses. So I've seen like extreme defiance, behaviours such as kind of soiling and wetting pants and things like that, but also, you know, those kids who really withdraw, and they're often the most worrying kids because they're not screaming out for help all the time. They're just shut down, totally withdrawn. So that sorts of thing. Lots of things in terms of I notice maybe that they're not progressing in their learning. I'm not seeing much growth from them. It can be really little things too. So keeping your eye out for any changes or whatever you see, and kind of talking to the teacher that had them before you, and you know, coming out through drawing. I've had a few kids, you know, drawing lots of really interesting pictures and things that, yeah, often can come out. And also in terms of social relationships, a real impairment in actually having really positive social relationships, making connections, often have real difficulty there.
Well, I think that pretty much covers it off. I think certainly in secondary college, secondary school, it's often about behaviour and really extreme, quite violent behaviours. Sometimes also, I guess in older kids, it's substance abuse. Sometimes as a principal, one of the great challenges for trauma, kids who have experienced trauma, is they don't attend school, and that presents a whole new challenge for us to try and find ways to get them engaged and back to school.
I think it really depends on where you start. Back in Karwatha, it was boat people. The significant things they'd gone through with pirates, getting to Australia, not being welcomed, etc. And they had to re-establish their life here. I had kids there, some of the brightest kids I've ever taught, but they were working to 12 o'clock at night and in the family restaurant or something, and then trying to study the next day. So they started with that level. At Doveton, it has been, and we see it from pre-birth right through. And to give you an example, we've got 40 out-of-home care kids who live in residential care. Now, these are young people who might be as young as prep, who don't live with their parents, live in this plastic environment, get shifted all the time, and therefore school is their only consistent. So that trauma is enormous for them. And they have to ultimately go into secondary school somewhere, and you'll see the behaviours and everything reflected in that. You see some of the Indigenous families, the impact of drugs in families, pre-birth underweight, family violence. All those things are just part of I suppose, the character of what we're seeing with the vulnerability. It's not a character we love in any way, but it's what we see and what we have to deal with in a school environment. What I can say about middle class areas such as Parkdale and places like that, they hide it better because they've got the supports around them. Places like Doveton, certainly they don't hide it as well because they just don't have the supports. And so schools become that area in which we can pick it up and start to work with it. You cannot teach kids in any meaningful way with high vulnerability and the level of trauma that we've seen in some of these young kids. So it's a whole different plan of action until you can get them basically in an environment where they feel safe. Once you've got that, you've got a chance. But that's so important at the school, and we all know that the work that they've done in researching high quality schools, the first thing you have to do is a high quality, safe learning environment. And safety is the first thing.
I'd just like to add on that too, because I forgot to mention before that my experience has been in primary school, particularly in lower primary. So I've taught Prep 1, 2, 3, and it's really interesting. I see kids come through, in Prep and 1, and I know that they've had particular traumas. They've been exposed to all of those events in their life that would result in trauma, and the behaviour doesn't necessarily come out. And then they hit about grade 4 and it starts to come out then. So, either they're really good at hiding it, or really they don't actually understand what's happening. They don't really know or understand that what happened to them potentially wasn't okay, or those things that they just don't really seem to react to that just yet. They might sometimes, but I see it comes out more and more as they go through, which is really, really interesting. It's really interesting to see kids that I'd taught, and I was like, oh, what do you mean that crazy behaviour, that really defiant behaviour coming out, that they were not like that at all. And then you think, okay, well, they actually had that trauma really early on, and that impacts them later on.
Mm-hmm. I might ask more about the response later on, because you've all sort of touched on response. I'm wondering, though, about how you identify. Is it through behaviours, or is there other ways that you can identify those that are more hidden traumas that have happened, or does it take time, or are there processes that happen to be able to identify, or is it just purely through behaviours that you see and the things you've been discussing?
Yeah, go for it.
So, look, I think that in my experience, the young person who has grown up in a family environment with a traditional family, does things after school, is involved in sport, has sort of is focused on schooling, does homework and all that stuff, very, very often they are not the ones that present with the trauma. When the behaviour leads to that trauma stuff, or we get a sense that something else is going on, there's a couple of mechanisms, which is referring them to maybe speak to someone at school, building a relationship with them in which or with somebody who they are comfortable with at school, and those things can lead to it. But often, you take a teenager to a wellbeing person, they're not interested in talking to them. Mm-hmm. So I think the most common way, though, is where you get behaviour that's really extreme, and I guess is not. It's sort of that inappropriate response, or that really extreme response to what would normally be quite a normal interaction, is where you start to look then what are the underlying features, what are the underlying issues around this child, what can we work out with what information we have.
Mm. I would say, exactly the same in terms of the relationship, especially with those younger kids, building that relationship. But they're not going to say, hey, this happened to me yesterday. And, often 9 times out of 10, they won't say, hey, this happened and this has really traumatised me. You have to kind of read between the lines. And for me, it was really interesting to learn the right questions to ask, because when you're dealing with these children and, you're potentially going to be talking to DHS and those sorts of things and putting supports in place, it's really important to question in the correct way, so that the kids, you're not necessarily putting words in their mouth kind of thing. So that was really important to learn, that kind of questioning and how you could help that child feel really safe. But it definitely takes time to build that relationship and to get them to feel comfortable enough and to know that when they tell you that, something will be done about it, but it's not going to be super scary, because these kids, often a lot of them have been removed, or they're in out of home care, and it's really scary to tell someone, because then they're thinking, okay, well, I've told you, but what's going to happen next? Mm.
Certainly there's the institutional elements that you can pick up really quickly. If they're out of home care, there's probably a fair amount of trauma with them. If they've been mobile, we have about up to 30% of kids transfer or are mobile each year at Doveton. So 30% coming in, 30% going out. So we don't worry about census until the day before, effectively. But just that level of mobility in some families, when you've seen they've shifted 5, 6, 7 times in the interview, warning signs go up straight away. We also make sure there's only ever one interview, and we never turn a family away when they come in. If you turn them away, they run. They go elsewhere. And so it's just that one interview with all the key people there, but not too many, and we bring in people one at a time. And Michael's right, if you can see a young person who's got all those different elements in their life in place: sport, performing arts, school, stable environment. Not too many warning signs are going to go up. It's the one that don't have those little components that you start to say, is there an issue here? Most parents, if they're running, if they're mobile, are not going to say, I've got a huge issue with trauma with my young person, because it's a sense of saying, I'm a failure. And so occasionally they will, but very rarely. It is basically building a relationship with that mum, dad or whoever, guardian. And the way we do that is simple. We meet every parent every morning as they walk through the door. Every morning. Deb Gibson will be out the front meeting every parent that walks through. Why? They have an institutional distrust. And you have to break down that distrust before you'll get trust, and therefore the trust will lead to information. And so that's the first thing that we learnt at Doveton, that they want to be valued, but they want to be trusted, and the way to get that trust is build relationships.
Yep, absolutely agree with that.
Yeah, I would agree with that as well, and definitely my work with schools and specialist schools have definitely shown that as well, that development of a relationship. And I always like to remind myself, working as a psychologist, and I've worked as a school psychologist as well, I always like to remind myself that the families that we're working with, the parents, the carers, the guardians, they're also vulnerable and exceptional in their own ways. So they've also got challenges. They've also likely experienced their own trauma or adversities or current adversities. So creating connections as we would a trauma-informed practice with the kids is exactly what you would do with the families as well.
I'll just add one thing. So yeah, you're right, and the relationship is really important, but it's also doesn't mean that therefore then the issue is sorted. It's very helpful, but there's a family and Greg knows his family as well, he doesn't know who I'm talking about, but a young person who was removed from birth is in grade 6 and has been in 36 different out-of-home care arrangements. So a year 6 student who's 12, 36 different moves all in out-of-home care and removed from birth. So the principal at this school, and she's only been there for a little while, has built a really great relationship with this girl, which is fantastic. But what we're working on at the moment is getting her out of the principal's office and not lying behind the principal's car when she goes to back out at night, trying to make her stay with her. So there's a whole lot of other challenges that are presented once you have that relationship as well.
Yeah, that leads in really nicely, Lizzie, and I'll let you finish, but that leads in really nicely to my next question of the impacts on staff and the impacts on teachers of working with these kids. So, Lizzie, I don't know if you want to address that or...
This is huge, especially for me because, I'm still really early in my career, and in my first and second year I was presented with all of this trauma stuff that was coming through with these kids that I was teaching at quite a young age, and I didn't learn how to deal with that in uni. I didn't know, I didn't really know about vicarious trauma. I didn't have supports in place for myself to switch off from that and to say to myself at the end of the day, hey, you've done everything that you can for this child. Now it's time to remove yourself a little bit in terms of debriefing and all that kind of stuff. So I really took on a lot of what was happening, and I had to really learn how to not do that, because it's like that oxygen mask thing. If you can't put the oxygen mask on yourself, you're no good to anybody else. And so I think, you guys are all in that kind of, I think, first 5 years, or other people who have joined as well tonight. But that's such an important thing. And I've seen a lot of teachers really drown through it. And that's probably the best way that I've been able to deal with it.
Can I say, Greg, I'll toe the party line for the department because Greg's retiring at the end of the year. But one thing I would say is, look, it is really becoming increasingly an issue for us as a Department of Education to tackle. So the South East Victoria region recently introduced trauma-informed practice. Has been going around and doing a lot of professional development education with our existing teachers around that. And the department does try and work with an employee assistance program and things, so that there is an option for you to engage with professionals if you need to around that. It'll also come down to schools, and when you're, we would hope all schools, but obviously there is differences to that, but there'll be different models of the way that staff are supported with trauma kids in those schools. But they can be really great as well. In most schools they are, and that's about sort of supporting and providing access to debrief, and also having somebody who is perhaps in your first few years is actually keeping an eye on what's going on. So that's probably the best model when that's working.
Exactly, when it's working. I have a saying with my staff that we have to simplify complexity. We call it simplexity, all right? Because we have a really complex area. And from a principal's point of view and with leadership, we have to make it as simple as we can for the teacher in the classroom. Why? Because they'll drown otherwise. And to give you some examples of that, the idea that staff are there to save children. You're not there to save one kid, you can't save them. You can grow them, you can develop them, but ultimately they will still go home to something else at night. And I've had staff say to me, can I take this young person home? There's no one picking them up from DHS. I say, you will not do that, you cannot do that. Because ultimately down the track, if something goes wrong, they still have to come to school and you are still their teacher. All right, so we have to nearly pigeonhole. And I know that's really hard to do, but it's a development of resilience in teachers that says, this is my role and this is what I need to be able to do, and I need to rely on others to do other things. So to give you an example, we've got many young ones who come with significant trauma. Each has their own plan based on the interviews and everything we know about them, because unless we understand what is going on, you really can't have a plan. You're just poking in the dark. So it's that understanding and that knowledge of the young person. What are the triggers? What are the things that are going to set them off? And when the department says to me that I have to have the kids in class all the time, I say bunk them, right? Because they can't cope in class all day. And so we'll have a modified plan of action, all right, in which the support person who's often with them because they've got severe behaviour, they'll be funded. Then quite simply, we can say to that person, your next step is this. And it might be they run around the oval 10 times just to get rid of some anger or whatever it is. So it is really being able to step down a plan of action that has multiple exit points and entrance points, because that young person will arrive every day with different baggage about the experiences they've had overnight. And I've got a family, as I said, with residential care. He came to school a couple of days ago. DHS said he's had a bad night. What does that mean? Well, he's been on the roof with a knife. We're talking a 7-year-old. Okay, what's he going to be like the next day? And so to get him into class is a waste of time. You have to have multiple exits and entrance points in your plan of action. And you as a teacher can only do so much. You have to rely on your principal class, you have to rely on your wellbeing team, you have to rely on the parents or the carers to come and get them occasionally. You have to be able to circumvent the issues that can continually escalate all the time. And that's just a matter of... So the little wins are vital. We're not going to take great jumps in one go. It's those little wins and it's wearing. And as I say to staff, you therefore have to be able to pinch in a hole. Sometimes I basically go in and just take the class to give them a break. It just has to happen.
Mm. And so I did just want to ask, in terms of that approach, how do you then, Greg, how do you identify that there's been a challenging weekend? Because I see that too. So there's been an access visit, for example, or there's been some sort of traumatic experience, kids on roofs. How do you then know that that's coming towards you come Monday morning?
Well, effectively, it's the SSG that you have, or the interview at the start where you've this plan of action. You say to DHS or whoever's involved with them, if there's been an issue, we need to know. Not at 10 o'clock, but at 9 o'clock before they arrive in the school. Now, they are notoriously bad at doing that. And they're understaffed, under-resourced and all that, but it doesn't help the young one. So it's the signs that we're looking for. Every morning, this young fella, and I think the sister might be down at Monterey by the sound of things, we basically say, how are you going? What's happened? It's that discussion, that partnership you've built, that trust that they'll have in you. And we know straight away. You can tell from your own kids if they had a bad night. So really important you just look at the telltale signs and then work from there. And we will say to our APs, just make sure you keep dropping into that class, making sure the teacher knows you're there to support. The ES person, if there's an issue, you come and get it straight away. All right, we can't just let it go on. and we'll take them out for a bit and then slowly bring them back.
I think it's really important what you said then, Greg, just about making sure that teacher feels supported, because I've been in instances where I do not feel supported, and pushing for that support is really important, because if you don't tell your principal or your AP or your welfare coordinator or whoever you're could refer to this child to, they don't know what's going on and they don't know that you're drowning. So ask for help. That's my biggest tip, is ask. Make sure they know what's going on, because sometimes these families, they trust you the most because you build that relationship as an educator. So you need to pass that on and then start to build that relationship with the AP and the principal and those other people that can support you too.
Can I suggest also, if you want to get into an emotional fight with these young people, you're going to lose. They're past masters at it. All right, that's all they've lived, this emotional roller coaster. So you have to be absolutely, keep a consistency of approach in the way you determine things. Simple things. One instruction, not 5. All right, because they won't remember after 1 if they're heightened. And they might not remember that. But it's really keeping it very simple and very direct and take the emotion out of it. They're looking for an emotional way out.
Absolutely. Yeah, absolutely. A more neutral and calm and modelling for them that emotion regulation that they've potentially been missing from other models in their life. So what we're going to do, we've got about 10 to 15 minutes left. So as promised, now I'm going to open it up to the audience, and we're going to have travelling mics. So you'll need to make sure you have a mic and pop your hand up if you have questions for myself, for the panel, for any of us going forward.
Yes, I teach at school as part-time job, so I work at CRT at the rest of the time. I had many good experience and enjoyable teaching at some schools, but what here I'm going to tell is the worst experience I had ever. I don't want to mention the name of the school. Yes, I went to school, and the first sign I noticed was that the children, they didn't look at you. From class 7 to class 12, even the primary students, they don't look at you. And afterwards, I went to class 7 and then taught at class 9 and 10. And this child in class 7, he held a scissors all the time, all the class time. And no matter the TA, what the TA told him, he didn't let it go. So it was quite scary. Then four girls in the back, they made up their face all the time. So it felt really very unusual from my experience as a CRT. Then when I taught the mixed class of class 9 and 10, there were overall 8 students. They didn't listen to you at all, whatever instruction you gave to them, and they were they fought each other. They swore all the time. They washed themselves in the cupboard and claimed that they were family. And they threw the balls on the ceilings. And no matter what you said, you can't stop them. It was quite scary for me. It was worst experience ever I had. So in the end, I stopped the effort to teach them. So I just put up movie and they focused and be quiet. And I was very confused about this experience because I didn't have this experience before. The second time I talked about this school was in another school. And the teacher talked about the same school and he said, it's too dangerous. He's not going to go there again. And the third time was when I talked to the NCCD teacher at my own school. And she told me this is a special needs school, and all the students went there after they were dispersed by normal schooling. So I understood this whole situation only at the moment when I was taught this special needs school. So yeah, you gave Yes, thank you for your speech, and you gave a lot of very helpful suggestions. But here, what I want to ask is, so as a CRT teacher, you had really no opportunities to build a relationship with them beforehand. How do you help yourself with self-protection, safety, or?
Can I just say that is unfortunate, those experiences that you described, but they're not also uncommon, particularly in the schools that I've worked in. So that is a reality that sort of stuff does happen, and obviously sometimes worse. That CRT question is a really good one, because one of the things that I'm sure this panel will agree, the greatest thing you can do around the whole trauma or classroom management experience with kids is to build really positive and really good relationships with them. And coming in cold, that is really difficult. My advice to CRTs though around this issue is to get a really good handle on what the process is at the school, because it needs to have one in terms of how they deal with the challenging behaviours. Get in there, find out who it is that is the support network for you in the school, because there'll be someone that is required to support you. Know what are the steps that you need to follow. What is the process for the behaviour management process in the school. So particularly though, if you can try and get some consistent work in some of those schools, then you can get more involved and say, look, I'll come to your PD days, I want to know more about how the school operates. It is a challenge, particularly early on, because you're probably spread over a whole lot of schools, but if you can try and nail that down a bit, get their information on what to do, know who to go to when it's going wrong, but that's my best recommendation, and I know it's not a great one.
I'd say the same. I was working at a school and I had to physically restrain a child because they was so dangerous, and I got bitten all over my arms. They bled all over me. But the best thing that happened was that I had been in consultation with the wellbeing teacher. I had support from all these people around me. So make sure, you know who you can call when you need to. That would be, my number one tip.
Don't go back.
It can be pretty scary. Like you can, get some pretty intense stuff.
I think the school is...
Luckily it was a 7 to 12, so Hallam's out of that, so we're right, only at 10 to 12. CRT's the most difficult job, absolutely, and they should be paid a lot more than they're paid. I think the best thing about a CRT is that you find a school that you feel comfortable with all the PPD days and everything else, and you make a niche there for yourself, and you get consistent work there. You'll become part of the furniture after a while. The ability to go from one school to the next is an incredibly challenging thing to do. What you reflected to me is a school that doesn't have really strong culture around behaviours, and as a result, therefore, it doesn't have what probably would be strong leadership that's coming in to support you. Did you see the principal during the day? No. You don't know her, yes. So I think those things are really important. You'll get a sense of the school by walking in there, and you'll get a sense of who you meet and those around the school. I've got a view that our principal class should be around the school every lesson, and they should be out at lunchtime and recess talking to young people. Because you do not build relationships by sitting in your office, and most of the work that we have to do as principals can be done after hours.
Yeah, that structural change and leadership is really important. And it's definitely something that we find a lot when I talk to teachers and educators. That's something that isn't there sometimes and can be lacking, and it leads you into a position where you're having to manage things by yourself. So,
can I jump in? Just in terms of that, knowing as an educator, like who to speak to is really, really important, because I know that I've taken on the role of what a leadership should do, and that's really unhealthy. I couldn't do my job effectively, and I should have been leaning on them, and I didn't push for that. And so, just please know that you should get that support.
I think we're going to throw to a question from our live stream.
We got Jessie from the live audience. It seems much of the expertise in trauma-informed practice is contained within a small amount of schools. How can we begin to disperse trauma knowledge and approaches to all schools? The
3 models that are up there, we use Berry Street, and I'm just about to implement it at at Hallam as well. So it can go right from the starting point of early learning right through to senior secondary. What it is forget about the framework. It's the language you use. It's the routines you put into place. It's the way in which you think about young people. It is not about how you teach per se in terms of curriculum, but it is around the idea that you have to get that body of a young person, that understanding of self-regulation and everything in place before you can start to move forward with the growth. And I think if you look at things like Berry Street and the work Tom Brunzell and his team has done, it's amazing work. The thing schools do is they take it on and say, we're going to do the whole lot in one go, and it falls over. You'd never do anything like that. You piecemeal it out, identify what's important for your school and how you can work it into your classroom practice. And so if you look at the classroom practice at a Doveton or a place like that, it is kids will line up outside. Why? Because we want order. They will walk in, they'll be greeted. Why? We want the relationship. They will have that first 5 to 10 minutes of a chunk of a lesson in which the intentions put up, the success criteria, and that specific intentional teaching is done. They're used to the routine. All right, it gives them comfort. And then we go into the chunking of the lesson around what's the purpose of that lesson, and then finally at the end the outcome in terms of the conclusion of the lesson. Really simple models, but kids get to know them. And so things like Berry Street provide you a thinking platform in which you can then adapt into your classroom. So you don't need to rethink it yourself. And the best idea is then you can work with your colleagues on developing that.
So one thing to add, just to add to that question, I think there are some schools that do it really well and some schools that are still coming along. I was just checking on my phone, so the trauma-informed practice PD has been delivered to half the schools in the South East Victoria region. So this area is something that is really coming under the radar and is really focused on. Greg's right. Berry Street's great. There's other great models out there as well. And so one of the things will be, though, depend on the school that you're at, is finding out what they are doing, and if you are in a position to maybe influence that, that's really great. So I think that to answer that online question, it is something that is becoming more and more prevalent in departments.
I would say coming from, just as a teacher, not necessarily in no, but you know what I mean. Not necessarily in leadership, coming from that perspective. Having those conversations about it too with your colleagues and saying, hey, how are you kind of tackling this? I'm seeing this. Not being afraid to talk about that trauma that's happening in your classroom or in your space. Just, opening up the conversation.
I would completely agree with that, and taking on from what Lizzie has done in schools that she's worked in, it really needs champions. And so this area, like many areas, need champions in schools. And so teams in schools, that point person, that person who can rally the troops and to have a coordinated approach and a team approach, that's where I see schools are really able to. It takes time, it definitely takes time and an incremental approach, but having those people such as yourself who are really going to champion this area in your school.
Yeah, and if it's something that you're really interested in, find out about it. Find educators that you really follow and you believe in their practice and you believe in that philosophy and the research, and and really present that to your school if you can. I really like coming from the school that I was at. It was really nice because everyone was sort of seen as a leader, so you could come forward with those different ideas and say, hey, this is something that's happening. Let's address this.
Can I just remember, though, those frameworks are a tier 1, the classroom only. A lot of kids are beyond that. You're not going to solve it in the classroom. And so you need the support of the experts after that, in the sense of, not that you're not an expert, but the experts are psychologists, social workers, speechies, all the rest. That diagnosis is really important, and the strategies that come through that. And ultimately, there are other settings that occasionally kids have to go to, just to buy some time in which to get them back so they can actually succeed in your classroom. So there's those 3 tiers in which you have to understand where young people are at.
I'm glad you mentioned that tiered trauma-informed care. It's an area I'm very interested in. So we only have time for one last question. So over to you, questioner.
We've heard some of the more extreme things that happen in the classroom, but what are some of the benefits that you've seen from using trauma-informed practice in your classrooms or in your schools?
I would say much better student engagement, much better outcomes in terms of what my kids are learning, and basically just an overall better school experience. Kids are happy, they feel really safe, feel really comfortable. I would say that from my experience.
No, I just concur with that. So, I mean, if the school is working really well and it's really consistent and there's a trauma awareness and there's an approach to doing that and there's a framework in place and people know what to do when things don't go the way they should. And also, you know, there's also a little bit around, you know, the practice around making sure that the lessons differentiate and students can engage with it and they're not coming in late to be berated by you because you're aware of the fact that they've had some issues last night and can handle that, and it's calm and it's consistent, is you get a great school with teaching and learning can really thrive.
I would say also a happy teacher is
Happy school.
Yeah.
And a happy principal.
Most important, a happy principal. Just remember one thing, it is not an add-on. It is absolutely essential. It is good teaching and learning. And so the idea, you know, and this is where I'm dealing with senior secondaries, they think it's all about content. Well, it's not about content. So that's part of it. So your curriculum, your planning, you're basically going through how you're going to set up your structure of your classroom, understanding the kids. Your understanding of trauma is just part of that, all right? And it leads to great teaching and learning because you'll use the ideas that come out in terms of your language, your routines, your protocols and all the rest in the classroom across every kid. And so what it provides is a great consistency and a great classroom environment in which you can operate. So don't think it as add-on, think it as essential for irrespective of what school it's at.
It also doesn't single those kids out. You know, if everybody's being, you know, having that expectation and having those beautiful routines, makes them all feel, you know, like it's all good.
So I would just say as well, just in response to that, from a research perspective, the research in this area is very new. It's a very up and coming, and we're working as fast as we can from a research perspective. But the research is showing, and it is slowly starting to show, that these sorts of models and ideas and approaches, whatever model you decide to adopt or approach you decide to adopt, that they are actually having positive outcomes for the children, but also for teachers as well and other staff members as well. We're just in the very early stages of that research, but I can imagine, as we've heard from the panel, that is just going to skyrocket and continue over the next 10 years. Hopefully. So what I'm going to do now, we've officially finished this presentation. I'm going to throw it to Andrea again, who's going to close our session today.
And what a great way to close, really, because some of the main messages I've heard are that this is not an add-on, and in the importance of relationships. I don't think we can underestimate that. But I really want to acknowledge that coming here tonight is a really powerful statement of saying how important this is to you and the young people that you work with. So I would really like to thank the panel. Emily, thank you very much.
Oh, thank you.
Emily doesn't get a gift bag because she's at Monash. Greg, you. Lizzie.
Thank you very much.
So thank you so much for coming. I want to acknowledge the alumni early career teachers. You've had a long day, I know, and also thank the online audience. Please keep in touch. The survey is really an important way to give us feedback and make sure that we have your details as well. So thank you so much for coming, and I wish you all well.